I'm Bryn and I will be working on my client today, Lola. Today we are going to be stretching her spinal flexors by getting her into passive shoulder extension, actually spinal extension, using the hold, relax, stretch method. So I'm gonna make sure she's in her chair. She's sitting upright with her back supported. I have this rolled up towel here that I'm gonna place behind her scapula vertically. Lola, lean forward for me, please, and lean back to have, until you feel the towel. There we go. So what I'm gonna do, I'm gonna use my two hands as the working hands. I'm gonna place them right in front of her shoulders here, or right in front of her chest. And we're gonna go ahead and, Lola, what I'm going to do is I'm gonna send your shoulder blades back, and you're gonna enter a spinal extension, just like this. But I don't want you to work on it. I just want you to relax and let me guide you through it. So we're gonna go through the passive stretch right now for 10 seconds. All right, can I go any further?
That's good.
Perfect, so from here, we're gonna hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. I'm gonna relax for 4 seconds. Go ahead, stay relaxed. 4, 3, 2, 1. Okay, push against my hands as hard as you can. 6, 5, 4, 3, 2, 1. We're all gonna relax. Let go. 4, 3, 2, 1. And again, I'm gonna send you back. Let me know.
That's good.
That's good. Perfect. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. All right, go ahead and relax.
Hi, my name is Lola, and today this is my client, Kenny. We're gonna be doing the shoulder extensors. So for that, we're gonna do the hold and relax PNF stretch. First, I'm gonna make sure that Kenny is correctly positioned, his back against the chair. I need him to have his feet and legs wider than shoulder width apart. Perfect. His hands are gonna be together between his legs. And I'm gonna be standing right behind Kenny. I'm gonna have my fingers cupping the top of his shoulders and the heel of my hands on his scapula. For that, Kenny, I'm gonna basically slightly lean you forward during a passive stretch. So let's go ahead and do that. And then Kenny, can I go any further?
Yes.
Any further?
Yes.
Any further?
No.
Okay, so 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And I'm gonna relax slightly for 4, 3, 2, 1. And now, Kenny, I'm gonna ask you to work against me for 6, 5, 4, 3, 2, 1. We're gonna relax. 4, 3, 2, 1. And I'm gonna passive stretch again for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And I'll bring you back slowly to your resting position.
Hi, now with my client Lola, we're going to stretch her spinal flexors, lateral flexors. So we're gonna choose her left side. For this, I'm gonna have her sitting down with her back supported. And from here, I'm gonna be on her left-hand side, the side that we are stretching. And Lola, we're gonna do the same thing we did before, our hold, relax, stretch, where I passively stretch you for 10 seconds, we relax. And then we're gonna do that isometric contraction. So you're gonna push back on me as I send you this way. And then we'll follow the same protocol. So you're gonna end up like this. All right. So to start, I'm gonna put my stabilizing hand on near her hip to, you can let your hands dangle, that's okay. So I'm gonna put my hand near her hip to stabilize her pelvis. And what I'm gonna do with my other hand is I'm gonna hold her shoulder, or just underneath her shoulder joint. And from here, I'm gonna send you on over to the right side. You can let your hand dangle. How does that feel? Can you go a little more?
That is good.
Okay, I'm gonna hold you here, and we're gonna hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. From here, we're just gonna relax just a minute. 4, 3, 2, 1. From here, I want you to push your arm into me as hard as you can. 6, 5, 4, 3, 2, 1. Relax. 4, 3, 2, 1. And I'm gonna passively stretch you. How does that feel? Can you go a little more than last time?
That is good.
Awesome. For 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Come on up. All right.
Hi, I'm Kenny, and this is Bryn. So we are going to do the contract relax stretch on her spinal rotators. So first, I'm going to position myself behind her, and this is my stabilizing hand, and well, they will be both my working hands. One is going to be cupping on her left shoulders, and the other one is going to be at her scap on her right shoulders. So I'm going to demonstrate for you first, Bryn. What you want to do is you want to cross your arm and then tuck your hands under your arms like so. And I'm going to spin you to the left like so. And we're going to do so using the contract relax methods. So first we're going to do the passive stretch. Let me know if I can go further. Can I go further? Can I go further?
Perfect.
That's it?
Mm-hmm.
We're going to hold for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. We're going to relax for 4 seconds. 1, 2, 3, 4. So for this, I want you to turn the opposite against my right hand. 6, 5, 4, 3, 2, 1. And then we're going to relax for 4 seconds. 4, 3, 2, 1. And we're going to go back into passive stretch for 10 seconds. Can I go further? Can I go further? Any pain? Can I go further?
That's it.
Okay, we're going to hold it for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And we're going to go back to relaxed position.
Hi, we are with our client Lola here, and we're going to be stretching her left hip flexors. To do so, we'll have her lying supine with her head supported. Her hands can be wherever is comfortable. And from here, what I'm going to do is I'm going to be having my stabilizing hand actually bringing her knee forward in a knee flexion. So I'll ask Lola, can you bend your knee for me? Awesome, and then I'll bring it all the way up. From here, now that it's past 30 degrees, I can put my working hand actually on the top of her thigh near her knee, while my stabilizing hand is going to be on her back thigh, just above her knee slightly. And from here, Lola, we're gonna hold a passive stretch. So I'm gonna hold this and bring it up through your range of motion. How does that feel?
That is good.
Okay, now we'll hold this stretch here for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax for 4 seconds. 3, 2, 1. Now from here, I want you to push back on my hand. Awesome. I want you to try to extend your leg. Try to extend your leg. Awesome. From 6, 5, 4, 3, 2, 1. Go ahead and relax for 4, 3, 2, 1. And lastly, I'm going to bring you through your range of motion. Relax your knee here. How does that feel right here?
That's good.
Okay. For 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And we'll go ahead and bring her leg back to neutral position.
Hi, so for this next stretch, we're going to be performing the hip extensors on Bryn. For that, we're going to use the contract and relax stretch method. We're going to make sure Bryn is supine, laying on the floor with her head and neck rested and supported by a pillow. We're going to make sure that her hip and knee is at a 90-degree angle throughout the stretch, which we're going to bring her leg up. My working hand is going to be placed on under her thigh and then above her knee. My stabilizing hand is going to be placed on an uninvolved leg, stable on the ground, with my hand placed above her knee, on her thigh. For this, we're going to be doing a passive stretch, Bryn, and then we're going to relax for 4. Then we're going to perform an isotonic movement or isotonic stretch in which you're going to push against me, and we're going to be working towards the floor. And then I'm going to relax for 4 and do another passive stretch for 10. So let's go ahead and do that, the passive stretch. Can I go any further than that?
Mm-hmm.
Okay. What about here?
Okay, that's good.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And we're going to relax for 4, 3, 2, 1. And you're going to work against me for 6, 5, 4, 3, 2, 1. And relax for 4, 3, 2, 1. And another passive stretch. Can I go any further than that?
Yes.
What about here?
Perfect.
For 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And back to neutral position.
Hello, I'm Kenny. This is Bryn, and we're going to do the whole relax with antagonist contraction stretch, stretching her left leg. So this is her adductors. So we're going to have Bryn on a supine position. So for demonstrate, Bryn, what we're going to do is going to bring your left leg as far out as you can, stretching it. Okay. And then I'm going to position myself to her side. This is my stabilizing hand. I'm going to place this right above her knee. And my working hand is going to be right where her ankle is, right under where her ankle is. And so Bryn, we're going to go into a passive stretch of 10 seconds. I'm going to slowly stretch your adductors. Can I go further? Can I go further? Can I go further? Can I go further?
Yeah.
Can I go further?
Yeah.
How about now?
Okay, that's good.
Right there. We're going to hold for 10 seconds. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then we're going to relax for 4 seconds. 4, 3, 2, 1. And then we're going to go into an isometric contraction. So Bryn, I want you to bring your leg the opposite directions. I'm going to pull it back, holding it, okay? For 6 seconds. 6, 5, 4, 3, 2, 1. And then we relax for 4 seconds. 4, 3, 2, 1. So Bryn, for next, I'm just going to place my hand right here. But I want you to do the active contraction, okay? Mm-hmm. So go as far as you can. For 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then we're going to relax back to her next position.
Hi, we are here today with my client Kenny, and what we're doing today is stretching his hip abductors using hip abduction. And we're going to start on his right leg to do so. To start, we want him to be supine with his head supported by a pillow. His hands can be wherever is most comfortable. And today, Kenny, what we're going to be doing is called a stretching routine called hold, relax with antagonistic contraction. To do so, I'm going to place my working hand on his distal thigh, just above his knee. And I'm going to place my stabilizing hand just underneath his leg, slightly above his ankle. Now, Kenny, what we're going to do today is you're going to cross your feet. That is the whole movement, just like that. All right, our hands where they should be. And I'm going to bring your leg over your other foot and let me know, is this, can you go anymore?
No.
Okay, we're going to stay right here for 10 seconds, doing a passive stretch. 9, 8, 7, 6, 5, 4, 3, 2, 1. Let's relax for 4 seconds. 3, 2, 1. Next up is the isometric contraction. So I'm going to pull to the left. I want you to pull to the right as hard as you can for 6, 5, 4, 3, 2, 1. Relax. We're going to relax for 4 seconds. 4, 3, 2, 1. Now for your active range of motion, I'm just going to be here for support. I want you to send your foot to the left side as far as you can go for 10, 9, 8, keep your legs straight, 7, 6, 5, 4, 3, 2, 1. And go ahead and relax. Place them back into a natural position.